We asked you, our viewers, to submit your most pressing questions. I'm thankful for the pensive responses. So tonight we have your answers. Once we get the 2 injections, how long are we protected? Is a booster needed at some point? Mark asks.
After the second injection of the vaccine, you achieve probably optimal immunity within about 1 to 2 weeks. And as far as how long it lasts, we still don't know.
Peggy wants to know, why do you have to get a vaccine shot if you have already had COVID-19 and have antibodies?
To try to improve the chances that you'll remain immune.
Will other medications, such as high blood pressure or any other medications, affect the COVID-19 vaccine? Thomas wonders.
We don't have any evidence that taking medications for medical problems should decrease the effectiveness of the vaccine.
Jane is curious about whether there are any prophylactic measures one can take before getting the second shot to prevent or minimize the side effects.
We don't recommend taking anything ahead of getting the vaccine, but certainly if people develop fevers, body aches, they can take over-the-counter medications like Tylenol or ibuprofen.
What's the story about men's fertility in the COVID-19 vaccine? Pierce asks.
Well, the vaccine has no effect at all on male infertility. In fact, getting infected with COVID-19 has been reported in some cases to result in erectile dysfunction. So even more reason to consider taking the vaccine.
And Claudia wants advice, asking our experts, what are the thoughts on a 66-year-old receiving the vaccine with a history of anaphylactic reaction to penicillin?
We know in very rare cases that people with a history of severe allergies can have an allergic reaction to the vaccine. I think for people who have had severe allergic reactions before, they should consult with their doctor.
Teresa asks, is it safe to receive the vaccine if you have allergies? I'm allergic to sulfa and all fish.
There's no evidence that you're at higher risk of anaphylaxis with the vaccine.
We thank our viewers for those thoughtful inquiries. But tonight, still the biggest question on people's minds is the unavailability of the shots. We turn back to Chicago Department of Public Health Commissioner Dr. Allison Arwady, who can help us answer these questions. I think the first thing people say is, where do I begin? Do I need a number? Do I have to go online? Can I call? So walk us through the process.
Yeah, absolutely. So here in Chicago, I would refer people to chi.gov/COVIDVAX, the COVID VAX. And if we bring up the website here, there's a lot of information. We're updating it every single day. And I know the big question is right here at the top, find a vaccine.
Right.
You click there and you go to Vaccine Finder, and you'll be able to see the 4 ways Chicago residents are getting a vaccine. First and foremost, through your healthcare provider. Reach out to your doctor, reach out to your hospital. They are also reaching out to you.
But we got calls from a number of people who said, I called my doctor and they said, I don't have it.
Yes.
Call the city.
Yeah, that's right. And we do have about 500 providers that are already enrolled. We're still, again, it's all about having more vaccine and more available. But I do want people to know that's a good first place, and especially if you've gotten care through one of our hospital networks. We push vaccine to all of our hospitals every week, and they are reaching out again to existing patients. So that's one place to look.
Okay.
Secondly, we have pharmacies, and you can see there are direct links here to all the pharmacies that we're providing vaccine to here in Chicago. So,
and that's certainly easiest, I think, for people. We go to the pharmacy all the time anyway, right?
Yep. And so each of them does have right now their own registration link. We're hoping eventually, these are national chains, that they'll be more linked into one system.
Do they have vaccine right now?
They get vaccine every week.
Okay.
Every week when the city gets vaccine, we distribute vaccine to healthcare providers, to pharmacies, to employers, and through ZocDoc. So those are the ways. And so they get vaccine every week, and they do have appointments available. But as you said, they just go like this. And so I want people to recognize that this is one of the ways to look, but don't go crazy refreshing it and refreshing it and refreshing it. And more and more is coming every week. The third is that many people are getting getting vaccinated through their employers. And CDPH, if people work for some of these manufacturing settings where we've seen big outbreaks, or through our schools or through public safety, some of those prioritized, those folks are getting vaccine through their employers. You don't need to do anything at an individual level about that.
Okay.
We're organizing it through employers. And then finally, ZocDoc. So ZocDoc right now is where you can sign up. You can click here, ZocDoc.com/vaccines. You can go put in, you start with the state, you say find availability. And importantly, if you do not have vaccine appointments right now, you put in your email address and your zip code, and it will email you when vaccine appointments become available. So this is helping get out of the I need to refresh every few minutes. And the Chicago Department of Public Health puts vaccine appointments in here when we have them available to the public. We also have a number of providers that are already enrolled, and we've got another dozen or so that are coming on as they have more vaccine. This is going to become an even more important platform.
I know there are several seniors at home saying,
Yes.
I can't navigate the computer.
Yes.
Is there a phone number? Is there anyone manning the phone?
Yes. So if people call 311, for example, we certainly will talk them through this, but we don't have vaccine appointments yet. And so we are going to have a dedicated call center with a dedicated phone number. The plan is to help people be able to fill some of that. But I would refer people back here, particularly, if they've got someone who's looking at this. We've got particular things here for individuals, employers, healthcare workers, essential workers, and seniors. And we're going to be doing more outreach specifically for seniors, recognizing that a lot of them may not be as likely to be online. We already have work happening in a lot of our hardest hit communities to bring vaccine and bring people with the iPads to them, right? Help people navigate that, make the appointments.
I know. I woke up, set my alarm, and did it for my mom, right?
Yes.
I mean, that's what we have to do,
Exactly.
is help out.
And we're up to 1 in 5 Chicagoans over 65 vaccinated. So we're making progress. And one of the reasons we've not expanded that category is I want to make sure our oldest Chicagoans can get vaccine. So more will be coming, but you can explore more of the website here. We have information on here about vaccine providers, our equity work, additional resources if you've got other questions, videos I've made explaining the science behind the vaccine, and lots about our data if you want to see what your zip code looks like related to how much vaccine has happened, for example.
Dr. Arwady, thank you so much. I know people have so many questions. It's so nice to have you here to be able to answer them.